good afternoon, everybody, and welcome back. We are on to our third and last session of the summit today, and we're pleased to have three people talking today and presenting about we have a kidney transplant patient panel discussion. We have with us today, we have Michael Mace. Michael has had his donated kidney for more than 20 years, diagnosed with end-stage renal disease in September of 1997. He has had his transplanted kidney by July of 1998. Michael has worked as a renal social worker for 17 years, is now a full-time social worker at Fresenius Kidney Care in Tacoma, Washington. Michael participates in speaking engagements, is on the medical review board and the patient affairs committee for the Northwest Renal Network. Tony Bims is a kidney transplant recipient from Riverside, California. Her end-stage renal disease journey began in 2008. She received a deceased kidney donor kidney in June of 2019. Tony is an active member of the ESRD Network 18 Patient Advisory Committee and the ESRD National Coordinating Center, National Patient and Family Learning and Action Network. She helps develop resources to assist patients and families in becoming active members of their health care. And also we have Johnny Jones. He is a kidney transplant recipient from Chesapeake, Virginia. Johnny started his in-center hemodialysis in 2010 and received a deceased donor kidney in 2017. Johnny is a volunteer for Quality Insights Renal Network 5 and a patient subject matter expert with the ESRD National Patient and Family Engagement Learning and Action Network. He enjoys walking, swimming, biking, yoga, golf, and projects around the house. So let's welcome our panel for this afternoon's discussion, and I'm going to turn it back over to Michael.
Thank you, Miss Stephanie. I want to thank all of you for that and that wonderful welcome. That's great. As a member of the NPFE-LAN Legacy Group, a dialysis center social worker, and a kidney transplant recipient, it's an awesome honor, a wonderful honor to be here with everyone today. I've been a volunteer with the ESRD NCC for many years, probably about four or five now. I hope by sharing our experiences that we can provide knowledge and hope to the individuals who are dealing with kidney disease. Today we have two additional kidney transplant recipients. We have Johnny and we have Miss Terry, and they're going to share their personal experiences with the panelists and how they're working through this COVID-19 pandemic that is impacting everyone's life. We have also saved some time in the agenda for questions from the audience, so please save your questions for the end. And with that, I have about a dozen questions here that were selected that we will kind of go through as our journeys as we've done through the dialysis and the transplant. So I'm going to ask the first question, and this either Tony or Johnny, either one. What was the hardest part of the transplant experience for you? What was the hardest issue that you faced? Either one.
Go ahead, Tony.
I was going to say, go ahead to you. Good morning, everyone. Okay. Good morning, everyone. I am Tony Bims, and the hardest part for me was realizing that I would need a deceased donor. That is hard. That is hard to want or understand that someone else has to pass away for me to receive it. I had a living donor the week before the transplant was scheduled. We found out she had a medical issue and would not be able to be my donor. I'm glad we found out because she was able to get her medical care that she needed. Then I had the opportunity to be on a living donor chain. And I'll explain that briefly. One person has a kidney that they want to donate to a family member or a friend, however, they don't match. And then the hospital, the transplant facility starts looking for matches. And there was an extra kidney available. I was considered. And at my last possible step, just for them to determine where the kidney would be placed, which side of my body, we found out that my arteries had started to harden, and therefore a living donor was no longer possible. I held my breath for a second and asked the question, so does that mean I won't be able to have a transplant at all? And they said, no. Immediately it was yes, you can still have a transplant, as opposed to no, which would have sunk me. But my doctor said, yes, you can still have a transplant. It would just need to be a deceased donor. So that was difficult. When Derek and Dawn were speaking about the process and the difficulties of obtaining a transplant, some of those things were there, but I think I'll talk about that in another spot. It was actually staying on the list at one of the facilities, one of the hospitals that I was registered at.
How about you, Tony?
Oh, I'm sorry. Go ahead.
I mean, Johnny.
Yeah, I think we all have a commonality when it comes to getting on the transplant list, because the road to a transplant is just, it's not clear. And right now, I think a lot of patients now are becoming advocates and also advisory, getting on a lot of committees, and they are, getting that focus point with that always been a hurdle for us is being educated and getting information and going and obtaining that reliable type information that we can use and getting a transplant and information on how to get on the transplant list. I think I went about 5 years before I even knew about transplant lists. And once I got on, it's going up to the date that I got transplanted. They was giving me it was where I got registered at was giving me percentage where I was at, on the list, but I didn't know anything about 15%, 20%, on listing on the list when I was gonna get transplant. So my focus point at the time was just dialysis. I wasn't even thinking about the transplant, but I was working toward it because I stayed healthy. I was eating right, and I was at I don't know when the evaluation came in because I can remember I got the transplant in 2017, and I remember going doing all the evaluation and everything like 2015. So I went from 2010 up until like 2015 without any evaluation or whatever, anything that I know of. But that was one of the point in that we have that transplant patient have now as far as we need the information available, and then we need information that we can rely on. And I got on mine through a lot of the advisory committees that I joined, and just being an advocate. And I think that was a big contributing factor for me when I did get a transplant. I I know what some of the things to expect, and you know, that was about the hardest thing, just not having that information available when I needed it. And I think a lot of patients now, by advocate groups and advisory groups that have that resource available to them, cleared a lot of that hurdle for them that I had a hard time gathering.
For me personally, I had my transplant 24 years ago, and it was a little bit different ball game because one, there was no COVID, and there was no 5-year waiting list back then. 25, again, I got mine 24 years ago, and so, but the issues, as everybody has related to in the past, has been, again, getting all the education, learning all you can, because when you get there, with transplant, you're looking not only on the here and now and obtaining the transplant, but what are you going to do after you get the transplant? What is your life going to look like? So you're going to start in the beginning with the end in mind. And I was very fortunate that I had social workers, my dialysis social workers, who helped me lead me down that path. And my biggest barrier was that I was running a restaurant. I was restaurant manager, and I could no longer work. And then I had to wait for Social Security disability. And in that interim of waiting for the Social Security disability, I became homeless, and I could not afford to drive a truck, my vehicles. I had no money, and I was basically, until I got my first Social Security check, was the month of the beginning of July, and I got my transplant July 20th, and it's just trying to stay healthy during that time when you're having to catch the bus. Fortunately, I had the gym for myself that I could go to the gym and work out and get cleaned up, but that was my personal toughest barrier. Next question would be, what was the best part of your transplant process? What was the best thing about that? Go ahead, Miss Tony.
Oh, here we go, me again.
Yes,
The
ma'am.
best part. Okay, gentlemen. Okay, I see how we're working here. My question, Michael, is first, before I answer that, is where were you transplanted? What state were you in?
I was transplanted at the University of Washington Medical Center in Seattle, Washington.
And that's also a significant difference in terms of time,
Right.
because different locations around the country have different wait times. I'm in California. I waited 11 years for my transplant with a deceased donor. And to Johnny's point, I started right away as opposed to the 5 years. And UNOS has changed some of the regulations in how they actually allocate organs. So some of that has been taken care of, but not a whole lot. But so I wanted to state that for those who are listening. I don't know who our audience is, actually. I don't know if our audience are people who are looking to be transplanted or if we're preaching to the choir. Oftentimes in these summits, we're preaching to the choir. So I just wanted to put that out. Now, as far as what was the best part of the transplant process, was experiencing love, care, and concern. That was the best part. There's a family that I met who became my family. They adopted me. My family lived a distance away, and this family, when I talk about them, I still get teary for the way that they just absorbed me into their family. And on those days where I had to get to the hospital, where my body just, I went to a doctor's appointment, first time with this doctor, and they couldn't find a pulse. I was breathing, I was alive, but my numbers were so low until my blood pressure was so low, the doctor was like, "Oh, I'm sending you to the hospital." I'm like, no, I just need pickle juice. Just give me pickle juice and I'll be okay, because that'll raise your blood pressure up, right? And they said, "Nope, we're sending you." I called this family. They happened to be across the street from the doctor's office having lunch. I called, I said, "Bring me a pickle and come get the car." They beat the ambulance there, but they allowed the paramedics to come in the door first, and the pickle was right in my face, but they wouldn't let me take it. So I went to the ER and I stayed there for a few hours, and then they sent me home. I'm like, I told you all I needed was a pickle. So the best part was meeting this family and having them absorb me into their family. Even now, they were part of the people who, as I stated earlier, I had a living donor. It was a friend of theirs who wanted to give me a kidney. I have nieces, nephews, godchildren, I have a host of family, but at the time, I didn't want any of their kidneys. My siblings are older than I am. They're unable to donate because of their age. My nieces and nephews and godchildren were all beginning their families, and I didn't want to put them at risk. And not knowing how my failure actually happened, I just didn't want to do that. So I am grateful for this family. I'm grateful for their love, their care, and their concern. And that was the best part.
How about you, Johnny?
Yeah, mine's basically it was so much great things happened. Like I was on dialysis for 8 years, and for that 8 years, I didn't go nowhere, no place but between dialysis facilities and home in church, and that was about it. And once I got that my transplant, it freed up my life, freed up my time, and it made my horizon, more brighter. I haven't been home in 8 years to, I live in Columbus, I'm from Columbus, Georgia, and I haven't been there in 8 years. And when I went back, the city done rebirthed itself. It's everything to change, like it was a whole new world around me, that I was living in this bubble. And I think that's what dialysis does to a lot of people. And I know a lot of people, they travel, when they're on dialysis. But every time I think about it, I think about the story of Manute Bol, when his going to different facilities, and what he got from another facility that weren't unaware of his condition, his treatments and everything. And it just did him, the worst. So my mind always went there, and that's why I just stayed in my bubble and stayed home. So my best part was, just getting a transplant, and, getting new horizons, being able to go places. And the diet part changed also. That was a new awakening. And then, and also I work out a lot. And while I work out, and you're on dialysis, you got to think about your water limitation and stuff. And that puts you at a point where you want to drink a lot of water, which I was prohibited from doing. But after the transplant, it was like, whoa, I could go for it, And that's what the nephrology wants you to do. Plenty of liquids. And that was my best part right there. Those two, traveling, and those restrictions and limitations was lifted.
Awesome. No, for me, the best part was that when I went on dialysis, I had been a diabetic for 23 years, and I got a kidney and a pancreas on my transplant. And I knew if I would have stayed on dialysis, I probably would have deceased within 5 years. That's how brittle I was and how bad I was. And I wouldn't have been able to see my sons graduate high school. And that was my only goal, see my sons graduate high school. And from there, you know, the best part was that after I went back to school and got my master's degree, I get to serve patients in this community. I get to help patients get a transplant as a dialysis social worker. I had a 60-month stint before COVID where I assisted 27 patients getting a kidney transplant. You know, and the look on their faces when they come back to the facility and say, "Hey, I'm okay," is just priceless, priceless. That is the best, that I get to serve this community, and I'm still alive. So, yeah, it still brings tears to me. But
Yeah.
Amen.
Next question. What was the biggest barrier of getting on the wait list? What was the hardest part of that?
I'm going to go ahead since it's my turn.
Yes, ma'am.
Okay. The biggest barrier, I really didn't have any. I started immediately with the question, what do I do? How do I get a transplant, and what's necessary? My nephrologist, my social workers, all of those things. I will say there was a 2-year lag because I started treatment 2 years after diagnosis. When I crashed in to kidney failure, I said, "Oh no, you're not giving me dialysis. No, I don't need it. You haven't let me try to get this thing better. Maybe there's something I can do." My nephrologist said, "Okay." And for 2 years, I was able to stave off dialysis because I learned what I needed to do to keep my kidney healthy. And in all of the packs and everything that I've been participating on for over probably almost 10 years, 9 or 10 years now, my statement is we need preventative information. We need to know what's going on and have PSAs. As much as we do about diabetes, we need to have that same type of information for kidney failure. You hear about kidney failure once a star or some celebrity has kidney failure and then all of a sudden gets a transplant. Okay, we're not going to talk about that. That's a whole nother issue for me. But recently, just after the conference that we had in 2019, I saw a PSA and she almost looked like me. I'm like, yay. Okay, I'm sorry. So I was so excited to see that there was some commercial that spoke about kidney failure and what the signs and symptoms were. I was just excited. And there have been times when I wanted to come off of the panels because I felt like, are we doing anything? And my husband, when I saw the commercial, I said, that's what I've been hoping for. He said, well, I guess you're not getting off, huh? I guess you're making a difference. Okay, I got to stay. And so I was happy about that. But the barrier is when you have something Dawn said earlier. I was registered with 2 hospitals. One hospital was very close, well, not close. It was close enough to my home. The other one was a few hours away. And the agreement was there's no point in doubling the exams and the tests and the lab work to be on the transplant list. Everyone agreed. I called into the both centers to let them know, remember, I've had my evaluation this year. Everything is clear. You can get the documentation. I did that for several years and called in, checked in with the facility. There's one facility where I actually had the evaluation, and the other facility, they would just get the information and talk to me over the phone. I got a call one day that asked for my address. I said, well, yeah, you can have my address. This was a social worker, a kidney coordinator. transplant coordinator. And she called and said, oh, I just need your address. I said, okay. I gave her my address. Within the week, I received a letter that said I was removed from the transplant list. I couldn't understand that. You just spoke to me. So I called and found out what was going on. Oh, well, we don't have any documents. There's no information we had, so we have to take you off. But the person called me and could have asked me, and I would have told them I have been consistent. Well, we don't have it. Okay, well, this is what actually happened. The coordinator who I had been working with for probably 7 years had not put anything in the computer for the past 4 years. I was kicked off the list, had to reevaluate for that hospital when all of my records were documented at the other hospital. I was not happy. So when I went into that evaluation to get back on the list, everybody was very nice. Oh, Miss Benz, we're so glad you're here. We're going to take care of this. We're going to make, I'm sure you are. If I've been doing my part, I expect you to do yours too. And when I tell you, everybody was very nice to me that day. Oh. So the barriers can be just trying to stay on the list, trying to stay healthy, trying to make sure your labs are right, trying to make sure notes in your file are accurate. I had a nurse tell me one time in the hospital, well, you're telling me you're declining service? No. What I said was, a doctor just prescribed medication for me without knowing me, without reading my chart, and you expect for me to take it. What I said was, when this doctor comes back to my little bitty room in emergency and tell me why he's changing my medication that I've been working very diligently to get my blood pressure under control, then I might take it. But if you wrote denied service or against medical advice, I'm gonna have a problem, because I'm gonna read my chart and you're gonna have to explain to somebody why you did that, because this goes towards my ability to get a transplant. Okay. I have have the doctor come back. So being able to be an advocate, that's why I said I think I'm preaching to the choir here. We have to be able to speak up. We have to know what is okay and what's not okay, and how that affects our entire journey toward transplant or just good health care in general. That's it.
How about you, Johnny?
Yeah, my barriers, I guess, because at the time they just went, I guess, talking about too much about transplant. So I wasn't I wasn't really interested in it, because I didn't pursue it. I didn't say anything about it. As far as at the facility that I was at, so it never was talked about until one day. I was being treated at the military Naval Hospital for my dialysis, and I guess it wasn't preached a lot there, but they just up in the air just asked me, "Do you want to get on the transplant list, by the way?" And I thought about it. I wasn't too interested, and I said, "Well, yeah, why not?" So I wasn't even thinking about it really. And that goes back to me with that lack of knowledge and being educated about transplant, or just having that information available. I just didn't have that, and that was my barrier there. Just not knowing, and having anyone really really talk to me about it, other than they just brush it off me and ask me, do you want to be on transplant? I said, yes. Why not? And that was it.
For me, I didn't have a whole lot of barriers. I started my workup for transplant before I even went on dialysis. But what I'm seeing, because I see both sides of the fence here as patient and provider, and the communication is so important and so intricate, because what we're looking at is 4 entities. We have the patient, we have the nephrologist or kidney doctor, we have the dialysis facility, and we have the transplant facility. And coordinating the communication between all 4 entities can be quite cumbersome sometimes, and there can be a lot of gaps. And so again, as it has been mentioned time and time again, is as a patient being your own best advocate. And how you do that is, again, learning. The more knowledge you have, the more tools you have in your tool chest to advocate for you and for all those around you in that dialysis center. That is where I'm seeing the barriers. And again, as you all have mentioned, a lot of this has to do with communication, be it verbal or be it written, or it's just imperative. And again, learn, and be able to speak out, because with the knowledge that you learn, then you have the confidence. It builds confidence that you can advocate for yourself. And that's kind of where what I'm seeing. And when I'm able to, and having your social worker or your doctor or whoever helping you advocate, that's where it's going to help you down that path. Okay, next one. How did your families and the caregivers and the support you had, how did they impact you getting the transplant and being on the wait list? Yes, ma'am. Either one.
Okay.
Yeah, I go. Give you a break this time.
Good. Okay.
Yeah, my family played a very important role in terms of motivating me to stay healthy. And the only way you're gonna stay healthy when you're on dialysis is to get off dialysis, and that is getting a transplant to stay healthy. And that's about the only motivating factor that my family was playing, and that I know the important part that I play in their lives was my longevity too. And I know that had to do better than me staying on dialysis, and had to make that move and stay healthy and push for getting a transplant. And they family, I guess they all are motivating factors in doing our best and living longer too, and mental and our physical aspect come from our family also. And my family played a vital part in me and getting transplant and keeping the kidney that I have healthy right now. They are a motivating factor in that also. And that was my part.
And how about you, Miss Tony?
Well, for me, my family is always supportive of me. They've always been throughout my entire life, but they're, as I stated earlier, they're distance from me. But my everlasting support system is my Holy Family. And every step of the way, my faith in God and the promises that I've learned over my life, that He would never leave me nor forsake me, that whatever my needs would be, He would meet, that because of my belief in Christ, even if I didn't get that transplant. Even if my healing would be on the other side, I was okay. I wanted to be here for my sister who had a stroke right before I was diagnosed with kidney failure. I knew I needed to be here for her, so that was my motivating force, because I was ready to go. See you later. I'm out. I know where I'm going. Not in a suicidal way, but just a reality of my own faith. And I knew the Holy Spirit would lead me to the information to gain the understanding of the things that I would need, so I could use wisdom to make the decisions and choices that I was going to need to make. I learned early on what I needed to do to keep myself healthy. I needed to learn how to eat for my kidneys' health, my body's health without the kidney. And so my family, any gathering or anything, what can Tony eat? What is she going to need? And that's how they played a part. But in terms of walking this journey, without faith and without personal participation, this journey would be, why do it? If you're not going to participate in your own health care and expect somebody else to do it for you, yes, it's nice to have family and friends and other people who are going to advocate for you. But as Johnny said, if we don't eat right, and Mike as well, if we don't eat right, it doesn't matter what the medication is. It doesn't matter who else is trying to do anything. My prescription is my menu, my medication, and my treatment. That's what was going to keep me alive. That's what was going to ensure my safety. And that's what I still do now. So family and friends, they're nice for the love, support. We giggle sometimes. And when I can't talk, they have to understand because I'm tired. So going through the process. But with the transplant, all of it, it's a journey. And a transplant, we know, is not a cure. It's another treatment. And so maintaining this kidney, I'll talk about that later, but that's, you have to be all in or you're out. That's kind of how.
So agree. So agree. My best, with my caregivers, I had no social support. I was by myself, and so my caregivers were the nurses and the social workers at the dialysis center. And again, prior to my transplant, my social worker said, "Hey, you're a restaurant manager. I think you'd be a good social worker." I said, "Is there any math involved?" She goes, No. I said, "I'm in." So after I got my transplant, the following March, I was in school to be a social worker. And again, 2 years later, I was under her wing as an internship. And 6 years later, I was working side by side with her. So, it came full circle. So that was the best part of my journey, and being here and being able to serve my patients and serve this population has just been phenomenal. And it's been all my blessing. Can you tell us about the medications you take and how they are for you?
Go, Johnny.
Oh, okay. Yeah. Hey, I would like to just ask Mike, though, what's his secret for all those years with taking all that, his medicine with his kidneys? But anyway,
I'll get that.
The Prograf and then Mike Fotic, and what else we take? The Prolozone, yes, that's another one. those are required ones. I haven't had any problem with mine, other than when I first started out. I had to take so many of them, and then it just, dwindled down to like 2 in the morning and 1 at night, and each one of them, and the protozoan is just one, and small quantity, 10 milligrams. But as far as side effect from them, I haven't had any side effect, but I know you get it. You get a reduced immune system. That's automatic. And then also, by me being an outdoors person, you had to be very careful with the sun. So you had to use a lot of sunscreen and be careful the amount of time you spend outside in the sun, and taking your medication, the time slot, getting used to that. I picked mine. The doctor he picked mine. It was 8 a.m. to 8 p.m. But I'm sort of like a person. I like to either sleep late or get up early. I'm not in between. So I put 10 o'clock, 10 in the morning, 10 at night. That way, my nephrology have, which is great. He's a football friend of mine, and we also communicate very well. And he gave me a graph on when you miss, you have these valleys, and then you have these peaks. So your body gonna function different, how they absorb it. So he advised me, you have to stay, you're 10 to 10. You can't go from your 8 to 10, or either your 10 in the morning and 8 at night. You got to stay that. You can't fluctuate. You got to keep that valley and them peaks together. And I got on to that, and I haven't had any problem. I had been transplanted for 5 years and not having a problem with the medication at all. Been doing fine.
How about you, Miss Tony?
My medications are working well, other than the weight gain. I began to taste food again after the transplant, and oh, was it delicious. And with the prednisone, the combination of the two, I gained weight. I am working on getting that weight off. I have not had I call those the side effects though. But I have not had any problems with either of the three, my prednisone, Cellcept, and Procrit. No, I take Procrit still because I still have immunity, not immunity, but I'm cold. I'm still cold. I'm getting warmer.
Anemic.
Anemic, that's the word.
Yeah.
I'm still cold, but I'm getting better.
Yeah.
Oh, you know what I'm talking about. It's cold.
Yeah. I've been there.
Easy. And I had an opportunity to understand, get an actual physical picture. I told my nurse one day, I am so cold. She said, I know. I said, well, how do you know? She said, Tony, your temperature is 95.3. I said, what? I said, wait a minute. So you mean I'm sick in the other direction? Because if you're 3 degrees over 98.6, you're sick. So I'm sick in the other direction? She said, yes. I thought, well, I didn't know. It never registered because, when you take your temperature, you're 98.6, unless you're sick, right? 101 or something. It never dawned on me that you could be sick in the other direction and that your temperature would be less than 90. I was just, yeah. So with those kinds of things, those are the side effects that I've noticed. But taking the medication or being on target, as Johnny said, mine is 7 to 7. I start though at 4:45 in the morning because I still need to take blood pressure medication. And the window, I call it my, I'm losing my word. My fasting window is 2 hours before and an hour after my, what's the one? I'm blanking, and I take my medication. I know the names, but there's a window in which you need to take your medication, and you can't take it for me. And other people may have theirs set up differently, but I have a 2 hours before my my Prograf, and an hour after. So I'm fasting twice a day to get my medication in. Like I said, I start at 4:45 in the morning. I set my alarms. I have alarms. In fact, just before this session, I had to take another one, and I prayed that I would stay awake during this session. But you two are so engaging. I'm here. But other than that, and falling asleep. I will wake up to find out I've been asleep. I don't know when I'm dozing off, but when I wake up, I'm like, oh, I've been asleep. So that is probably what is most concerning about my medication, because I don't drive initially after I take the medication because I'm asleep, or depending upon where I'm going and what I need to do, I take it once I get to where I'm going. But other than that, I do not have a problem with my medication. And yeah, I'll say that and leave it for next.
Well, again, he'd ask, how long had I been on, how long had I been on 24 years, and what did I do? Well, we got a couple minutes left, so I'm gonna say what because of the prednisone, I've had skin cancer twice. And again, things didn't start falling apart till about 15 years in. My medications I take twice a day. If I don't take my medication at night, I cannot sleep. Now, again, after 15 years, the prednisone also caused me insulin resistance. And so I ended up having to go back on insulin shots because of the insulin resistance after about 15 years of having the kidney transplant. Again, I've had skin cancer twice. I've had some not totally contributed, but I would say it was a contributing factor was that the medication I'd had, they had to redo I had a small bowel obstruction, and they had to go back in and cut me and redo how the kidney and pancreas drained and they changed it from the intestine into the bladder. So I've had multiple surgeries because of that. Again, if we're going to talk, and I'll start this question off, how do you maintain it for so long? I'm going to tell you it's routine, routine, routine. Again, as Tony had mentioned, gaining the weight from the prednisone, that was the worst. So what my doctor said was, just drink water. Drink water every time you're hungry. Drink water, drink water, drink water, drink water. And the weight melted off. I just couldn't believe it. And then going to the gym. Have to have exercise. It reminded me of the Walt Disney movie Madagascar, and you see the little lemurs, and they're all move it, move it, move it, move it. That's what we got to do, and that's what I encourage patients to do. Whether you're going for a transplant or you're just on dialysis or no matter what, movement, movement, movement. It doesn't have to be totally strenuous. I mean, again, we got to learn to crawl before we can walk and walk before we can run. But it's exercise and routine. And that is what's gotten me through the 24 years that I've had my transplant. I was raised military, so everything had to be routine. And it has really paid off for me in the long run of having this kidney transplant. How about Johnny? Tony?
Okay, I'll go. The question was any challenges, right? Is this the one?
What are you doing to maintain your transplant?
Okay. I am learning. Let me say this. My transplant dietitian fell asleep on me, telling me what I was going to need to do for my transplant. It didn't work for me. And so I feel uncomfortable with this part of my journey because I know I was told, oh, you're considered healthy now, so you can eat what you want. Fallacy. If my kidney was damaged previously from my lifestyle, then I need to know what to do on the other side of this transplant. So I am uncomfortable with this part of my journey at this point. I'm 3 years in, COVID has been around, and so I don't want to go out and be around people anyway. So getting the information of what I need to do to take care of myself is my main concern post-transplant. And I know about shellfish. I know about some of the other things that we need to be careful of. But to really maintain this kidney and keep it healthy, because I plan on it being transplanted when I get out of here, because I'm not dying from kidney failure. Okay, you guys? Anybody need my kidney, keep me on tap. I'll share it. But that has been I think I don't know that I've answered the question, but my concern is accurate information post-transplant about how to maintain this new kidney given previous history. And it wasn't like I was a bad person and didn't know what I was doing before, but clearly something caused my kidney to fail. Not necessarily high blood pressure, because I crashed in, everything happened at the same time. So just getting more information and better health, because there's too many people, too many things out in the public. Oh, you need probiotics. Oh no, but not for kidney patients. We don't need probiotics, but you should have a prebiotic, but let's be sure about what that prebiotic, all of that. So once we understand, I understand and have a better picture of what's really healthy for my body based on my labs and what I need to do, I will feel better.
Mine's I maintain mine's well, previously I used to I exercise and work out. That was a daily basis. Like Mike was saying, the military, I did 27 years in the military, so it established routine. So my routine is getting up 6 in the morning, exercise, walk 3 miles, and that was a daily thing. But this past December, Christmas time, I'm getting ready to decorate the house for Christmas, and I had a fatal accident. I fell off the ladder and crushed my back actually, and I was I crushed it so bad the doctor him and I was joking. He said that he said, "Man, when I looked at your X-ray, it made me cringe." You know, we just started laughing, but it dawned on me later on, wow, I might not be able to walk again. But I was in a wheelchair from probably January to about February for a month, and finally, just to get my footing back and being just able to learn how to walk again. Man, that was one of the hardest things that I ever was confronted with. Just learning how to put one foot in front of the other, and even to stand up with balance. But I got that all down pat now. I'm walking right. I use a cane every now and then, but I'm driving my car. I'm doing everything that I was previously doing before. But just maintain this kidney. And the whole time I was in the hospital with a broken back, my nephrologist was amazed, saying, "Wow, your kidney is everything's perfect." During the whole time, my kidney was just acting like a Perla machine. I have any problem with it, but I found out that they had contributed with a lot of my previously before staying healthy, eating right, and just maintaining my mental capacity. Also, that had a lot to do with me getting back to at least 90% to where I'm at now. And just maintaining that kidney is a large part is, I said, stay active, exercise when you can, and deal with a lot of your kidney diet foods. Get educated on that too, because that plays a large part at the end of the day. And drink plenty of water. I think I went from as far as water. When I was in the military, I wouldn't drink water. I would probably drink about maybe 8 ounces a day. It was good if I drank 16 ounces a day. And now my routine is almost about 32 ounces a day on average, and that will play a long part in longevity of whether you got a healthy kidney now or you want to maintain a healthy kidney. Drinking water is the #1 source of minerals you can put in, and that's how I maintain mine: is exercising and staying active and drinking plenty of water.
Thank you, Johnny. Hoorah. All righty. We're going to wrap it up. Miss Stephanie, do we go for any questions or anything of that nature?
Well, I just hope that there's a lot of comments really in the chat. I know you've probably been busy, but if you can, in the next couple minutes while we're closing up, just a lot of, kudos to all of you for sharing your story today from everybody. You've been very inspirational. You've been, so transparent to tell us your story and share with everybody. I certainly have been inspired listening to you and really appreciate all of you being here today, taking time out of your day and to be part of this, CMS and the ESRD NCC NPFE-LAN Summit. We really appreciate that.